Liverfluke, Fasciola hepatica, is a trematoad parasite that infects grazing animals including cattle, sheep, deer, camelid species, rabbits and occasionally man. The parasite causes liver damage by migration of immature larvae and blood loss by the feeding activities of the adult parasite. The term for diseases caused by the fluke is fasciolosis. The liver fluke is now considered to be endemic in all regions of Europe. Eradication of the liver fluke is difficult because wildlife reservoirs can maintain infection on many farms. The objective, therefore, is to reduce infection to a manageable level that does not affect the economics of farm production. The parasite can cause significant economic loss, estimated at $200 million worldwide. A study of the financial loss in Switzerland in 2005 was estimated at €299 per infected animal. A more recent study involving bulk tank milk samples estimated the loss of production in dairy cows as a decrease in annual average milk yield of 0.7 kilograms per cow per day, and an increase in the mean intercalving interval of 4.7 days. The life cycle of Fasciola hepatica involves an intermediate snail host. In Europe, this is Galba limnia truncatula. The definitive host is a mammal, most commonly cattle and sheep. The success of the life cycle is determined by rainfall and temperature. High rainfall and humidity and a day-night temperature above 10 degrees Celsius are required to complete the life cycle. The life cycle, particularly embryonation of the fluke egg, is curtailed in temperatures above 30 degrees Celsius. In the UK and Europe, the two main periods of transmission of infection to the definitive host are from May to June and, more significantly, from August to November. With the advent of global warming, these periods of transmission have merged. Outbreaks of acute fasciolosis in sheep have been encountered by the Veterinary Laboratories Agency, VLA, in December and January. The minimum time to complete development from microcidia to metacercariae is 6 weeks. One microcidium can produce 600 metacercariae by multiplication within the snail. The life cycle within the definitive host is completed when mature flukes enter the bile duct and begin egg laying. This occurs 12 weeks after ingestion of metacercariae. It is important to remember that flukes are hermaphrodite, possessing both male and female reproductive organs. Despite this, reproduction in the definitive host is usually by cross-fertilization. Clinical signs in cattle are associated with chronic inflammation and the blood feeding of the adult parasite. Animals show weight loss and reduction in milk yield. In severe cases, there is hypoalbuminemia, anemia, bottle jaw, and recumbency. Chronic fasciolosis is commonly associated with diarrhea in cattle, although the exact pathogenesis of this is uncertain. Intercurrent infection with Salmonella Dublin and Jones disease are commonly diagnosed by the VLA. Subclinical infection is now recognised in cattle where there are poorer weight gains in growing cattle and lower milk yields in dairy cows without any other obvious clinical signs. Metabolic disease associated with chronic fasciolosis has also been described. The control of liver fluke in livestock is largely based on the use of fluticide drugs, either prophylactically or routinely, as well as in the treatment of individual clinical cases. One of the most effective anthelmintics is triclabendazole, TCBZ. And the timescale of drug action for TCBZ is 3 to 4 days. Drugs mainly enter the fluke by diffusion across the tegument, the skin of the fluke. Drug action is mediated through different drug metabolites. TCBZ combined with ivermectin can increase the effectiveness of TCBZ. According to the findings based on bulk tank milk samples from dairy herds in England and Wales, weather patterns in the winter and spring before the main disease challenge in the autumn can determine the likely risk of infection each year. Climatic factors likely to increase the risk of infection include rainy days in the summer, July to October, mild winters, cool spring, May to July, and warm summer, whereas climatic factors that protect against the risk of infection include mild spring, February to April, cool summer, July to October, and wet winters, November to January and February to April. Physical factors likely to increase the risk of infection include the percentage of grassland on a farm, disadvantaged least favoured areas status. This relates to the EU classification of land for agriculture. Presence and number of sheep on a farm. Whereas physical factors that protect against the risk of infection include the slope of the land, the size of the dairy herd, and the alkalinity of the soil. These are the sort of factors that can be incorporated into an early forecasting system and allows veterinarians to advise farmers on timing of treatment. The use of TCBZ has induced resistant strains of Fasciola hepatica that have been reported in Ireland, the Netherlands and the UK. Data from the Netherlands has shown that hares are important reservoir hosts for fasciolosis and may be a significant factor in the spread of resistance. Tests for drug resistance are being developed using methods based on fecal egg count reduction test and corpoantigen ELISA. Altered drug uptake and metabolism contributes to the development of resistance against TCBZ. Triclabendazole resistance is being monitored carefully by the licensing authorities. There seems to be a growing awareness amongst farmers that resistance to TCBZ is a problem and, as a result, they are switching to other drugs such as clostantel and nitroxamil. This should be done under guidance of veterinarians. Vaccine trials testing a number of fluke components have been conducted in Europe and South America. Although some of the results were disappointing, a field trial demonstrated that there was a significant reduction in the fluke burden in cattle grazed on naturally infected pasture. The dimension of the resistance in European countries and the mechanisms of dissemination of resistant flukes are not well known. This makes the control of the disease in livestock more difficult. Based on our results, we are preparing more advice on strategies to use to control fluke infections in the face of drug resistance, and it will be available on the Deliver website, www.deliver-project.eu.